So after such an inspiring moment, let's go back to work and go on with the first or final panel. And this panel is Regional Approach to Combat TB and Multi-Drug Resistant TB. And I'm delighted to invite two co-chairs for our final panel, Mr. John Ryan from European Commission, Acting Director for Public Health, Directorate General for Health and Food Safety, and Dr. Masoud Dara, Program Manager, Tuberculosis and Multi-Drug Resistance TB Control Program from WHO Regional Office for Europe. You are welcome to take over the panel. Welcome.
Good afternoon, dear colleagues. Before starting the session, maybe we would like to ask our distinguished panelists to come to the podium. Our Regional Director, Minister of Health of Armenia, and Minister of Lithuania. So I'm Masoud Dara, Senior Advisor at WHO Office in Brussels, and Acting Program Manager for Tuberculosis and Multi-Drug Resistant Tuberculosis Program at the Regional Office. And it's my privilege actually to together with John Ryan from the European Commission to co-chair this important session. We just heard from Dr. Vaira about the having dreams without borders, and that's actually is a very good connection to this session that we have. We are going to talk about cross-border collaboration, which is extremely important. In the last 1.5 days, we discussed different elements, from finance to models of care, to vulnerable groups, and research. Now, in this specific session, we would like to see which are the mechanisms for cross-border collaboration. And for cross-border collaboration, we're not talking only about migrants. Of course, migrants are important. I think many of us in this room have been traveling and living abroad for work. I am myself as an example of it. I've worked in Kazakhstan and Uzbekistan for several years, and then from Kosovo to Moscow, and then to Copenhagen. And the typical part of it was the time I was working in The Hague and living in Belgium. So crossing border almost every day to the work. So the question is that whether people crossing the border within the EU, whether they have enough access to quality treatment, and what are the mechanisms for that. So we would like to see what are the existing mechanisms that we have and how this existing mechanism can be improved, or what are the measures that needs to be taken to have improved these mechanisms. I would like to ask John also to have some few words and then go for the panelists. Thank you, John.
Good morning, ministers, colleagues, ladies and gentlemen. It's a great honor to be here this morning and to say a few words on behalf of the European Commission. Before we open the discussion, I'd like to maybe make a few remarks. First of all, in order to eliminate tuberculosis by 2050, I think the cross-border aspects on a regional and global level are extremely important. The European Union adopted a legal decision in 2013 which specifically refers to cross-border health threats and integrates and strengthens the existing EU legal framework in this area. The aim of the decision from 2013 was to enable the European Union to better prevent and to mitigate serious cross-border threats to health and health emergencies due to biological, chemical, environmental events and threats of unknown origin. Besides the already existing surveillance systems which we have in place, the decision also strengthens our prevention, our alert systems, and our response coordination at the European Union level. And this decision, I think it's important to note, is closely coordinated with the international health regulations. The two texts are very similar. For example, in the last 12 months, the Health Security Committee, which is the body which coordinates the response within the European Union, has been meeting almost on a daily basis and then on a weekly basis to discuss the response to the Ebola outbreak in Africa. And this means that the legislation is there and is ready to become operational in the case of a serious cross-border threat to health. And of course, we never know what the next threat is going to be. The decision also provides a very strong legal framework for joint procurement or joint purchase of medical countermeasures such as vaccines, drugs and diagnostic material, and we're actually launching at the moment the first joint purchase between the Member States for personal protective equipment for use in hemorrhagic fever outbreaks. These different legal instruments which have been put in place linked to the international health regulations are also complementary to general policies which we have in the European Union. For example, the European Centre for Disease Prevention and Control has developed a HIV action plan and a TB action plan. And both of these texts are now being revised by the European Commission with a view to proposing a new policy framework in the coming years. On the global level, of course, we also have initiatives such as the Global Health Security Agenda, which was launched last year by the United States of America and supported by, particularly in the European region, by Finland. And we're working together with the partners in the Global Health Security Agenda to see how serious cross-border threats to health can be addressed. And this is all being done, of course, working closely with the World Health Organization. And finally, I would just draw attention to something that was mentioned yesterday, which is the research program of the European Union, where we are investing substantial resources into the development of new products and new pharmaceutical products, particularly focusing on communicable diseases and tuberculosis. We also have the health program, which is focusing on the 28 member states, and you've seen during a workshop yesterday some of the concrete outputs of the health program. However, we also have to keep in mind that many of the issues relating to tuberculosis control are not only linked to the global cross-border aspects, but also have a more local nature. Within the European Union, for example, more than 70% of new tuberculosis cases are of domestic origin. This means strengthening the domestic, local and community response. It also holds true in low incidence countries where a significant number of cases are of foreign origin, where we need to look particularly at vulnerable groups, people living in poverty, the homeless, and drug users and prisoners. And the European Commission will shortly be launching, together with the European Centre for Disease Prevention and Control and the World Health Organization and the Council of Europe, a specific activity looking at prison health. These populations are clearly very hard to reach and require special community-driven efforts and measures. So in order to succeed with the fight against tuberculosis and this global target of elimination by 2050, all these aspects need to be looked at together, and countries need to ensure a comprehensive approach which also takes account of social and other policy aspects. I'd now like to introduce our first panelist, who is Zsuzsanna Jakab, who spoke to us earlier, the Director of the World Health Organization Regional Office for Europe. Thank you.
Well, thank you very much, John, and dear ladies and gentlemen. First of all, let me emphasize once again that in TB prevention and control, good progress has been made because we are reducing the incidence of TB every year by 4.5%, which is good for the MDGs, and we will achieve the MDGs, but this is not good enough to achieve our goal to eliminate tuberculosis from the European region in our lifetime. And that is our aim, and we have to continue to work on this, because we want to hand over a European region to our children which is free from tuberculosis. In the last years, and I would say 10 years since the adoption of the International Health Regulation, a lot of work has been done in the European region to build up the core capacities for IHR, But I must say that we are still not there. And the Ebola outbreak recently was a reminder that we have to do more and we have to do better for the international health regulation in every member state, in spite of the fact that Europe is one of the regions which is the best prepared among the 6 regions, but we still have to continue our work and go ahead because there are still gaps. And we reviewed that together with the European Commission during the Ebola outbreak, and we have identified a number of gaps. This also means that we have to strengthen the way how we review the IHR implementation in the member states. And you may recall that in the recent executive board, this issue was raised by several delegations who called on WHO to introduce a new system which does not rely only on self-assessment, but also there is an external evaluation of the core capacities. And when I talk about core capacities, this also includes and involves intersectoral collaboration, which is a key to achieve our goals in tuberculosis control. In the last few years, we have gone a long way to strengthen the cross-border collaboration in Europe. There has been a minimum package developed within the Wolfheze initiative for migrants, and I consider the migrants as an important issue to solve the tuberculosis problem in Europe, and this is why during this year in the regional committee, migrants' health and public health and migration will be one of the technical topics during the regional committee, and next year I hope to bring this back also as a formal item on the agenda. Beyond this, we have also developed very good links between the health authorities and also good links within the clinicians. Consortium, e-consortium, electronic consortium has been set up for the clinicians to ensure that if there are difficult TB cases in the countries, they can consult each other. And these initiatives are good practices, and we have to continue on this. It is very important that we have the supportive policies in place. Supportive policies like in the European region, the Health 2020, which promotes the whole of government, whole of society approach, and with regard to tuberculosis, this is key. And within that context, we have to develop the specific tuberculosis-related policies. One important development will be the End TB strategy, global one that will be adopted hopefully by the World Health Assembly during this year, and based on that we will further develop the European Action Plan, which also takes its learning from the previous 5 years action plan. So these are all very significant, but having said that, we also have to align the TB control activities with the health system strengthening approach, because if we want to be successful in TB control, we have to make sure that we move from the hospital care to the ambulatory care, from there to the integrated primary health care and coordinated care. We ensure universal health coverage and related issues, and all this requires political commitments. In the European region, the partnership with the partners, I think, has gone a long way, and we have very good partnership in place with the European Union for sure. And I'd like to use this opportunity also to congratulate our colleagues in the European Union for all the research and development and innovations they have been taking forward with the research programs of the EU. We also have partnerships with the other partners, also the civil society, and probably this is why we have been successful in the TB control, because we started partnerships earlier in the TB area than in many other areas, but we have to continue to work on this. If we want to be successful in TB control, what do we need? We need political commitment, that's without saying. Without political commitment, we will not be successful. We need the financial resources, both from the external donors, but also from internal sources, and gradually we have to move towards this approach. We need intensified action, but we also need a whole-of-government approach, because as we have seen in the previous panel, it will not work if we only stay within the health sector. Tuberculosis is not a disease of the medical sector only, and the medical sector in itself cannot solve its problems. We have heard it from the civil society representative also, who said very cleverly, and I fully agree with him, that this is a human rights issue, and this is also a social issue. So unless we reach out to the social sector, unless we reach out to the finance ministers and high up, we will not be successful. So these are all very important success factors, and in all this, the cross-border collaboration is very significant, because TB knows no borders. And therefore, our response should not know any borders either. It should be fully integrated on the European scene. And this is why I was so pleased to note when the European Union developed this cross-border directive that it was fully aligned with the WHO international health regulations. Thank you for that to John and everybody in the EU. Thank you.
Thank you very much, Zsuzsanna, RD. So before going to the next panelist, I would like to also ask you to make sure you have your headset with you. We go for the next panelist, His Excellency, Minister of Health of Armenia. Armenia is among one of the key countries who managed to make a lot of changes and reform their services and make them much more effective than they used to be. They have been also very pioneering, working with all different organizations in order to get the enough resources, but also the technical assistance. So it's our pleasure to have Minister of Health, His Excellency, Dr. Muradyan. Floor is yours.
Thank you so much for your kind introduction, dear colleagues, ladies and gentlemen. Unfortunately, TB is still among contagious disease having most harm and being the primary cause of mortality among the serious illnesses for the humankind, and takes approximately 1.5 million lives a year. Starting from the renaissance of the TB spread and prevention of TB in the Soviet period, indicator of incidence of TB decreases annually, but the problems of a global system of healthcare still causes huge problems inter alia in Armenia. Of course, mortality, TB mortality for the last decade was decreased 2 times and constitutes 34.7 cases per 100,000 population. There are, of course, the problems quite topical as regards the access to treatment and to medication. So Armenia is among high incidence and high burden MDR-TB countries. The Ministry of Healthcare, in the framework of the National Program against TB, sets a set of measures for prior diagnosing of TB. And policy of the healthcare in Armenia is diverted at unreasonably high level of hospitalization and hospital admission of TB patients, already mentioned by Dr. Jakab, as well as it is diverted to introduction of newest technologies and innovation in a transition from inpatient care to outpatient care. In 2013, a program for development of new products was launched in Armenia for treating and trying to fight MDR-TB, as well as development of new anti-type B compilations, control and diagnosing for TB were published by European department, European Regional Department of WHO. Thanks to support from WHO and the Global Fund, USAID, USDF, a new model of providing healthcare is initiated, like pulmonary TB treatment and primary or sensitive pulmonary TB biochemical preparations is provided. As regards more efficient use and cost effectiveness of the finances diverted to anti-TB treatment and by diminishing the spread of TB, of MDR-TB among hospitals, a new system of financing was introduced, transiting from the bed days to fixed cost of treatment, including TB as a disease in that list, as well as support from the Centers of Narcology was also supported and provided. New criteria for hospital admission and hospital discharge of TB patients from inpatient hospitals was developed, and it concerns with the global health coverage and diverted at improving outpatient stage of treatment, thus improving quality and availability of anti-TB services.
In this respect, we'd like to also mention that within the new model for financing by Global Fund, we plan maximum decentralization of our service for quick diagnostics, including penitentiary system. We are aware of the fact that fighting TB, HIV, and hepatitis C, we need to join efforts with the civil society, non-governmental organizations, and patients themselves. And we also need urgent measures of trans-border cooperation to solve general problems like control of TB among migrants who are the main risk groups in this country. Proceeding from the above, the Ministry of Health of Armenia is declaring its readiness to offer all necessary consultative and other help gained from our experience. Thank you for your attention.
Speaker is the Minister of Health of Lithuania. I'll give you the floor.
Dear ladies and gentlemen, tuberculosis remains one of the problems which poses most serious threat to the health of individuals and the society in general. It's one of the most widespread and dangerous infectious diseases. TB cannot be a problem to be solved only by one country. In a modern world, people travel from country to country, continent to continent, and the infection follows them. And we understand that under modern circumstances, communicable diseases are spread with greater ease, and the threat they pose is more and more topical. More and more effective measures to control the infection are being used to curb transmission and spread of TB. Yet we need closer cooperation with our colleagues from other countries as well as international organizations in order to raise effectiveness of anti-TB protection, especially dealing with MDR-TB, we need to introduce recommended more effective measures of controlling TB. Most important is active detection of TB among the population, especially most vulnerable groups. We need not forget such preventive measures as checkups, because early diagnostics and timely treatment increases the percentage of cured patients, and thus protects the population of the country and the country's neighbors from imported TB. Apart from the said measures, we also need quality and timely treatment of every case of TB, to which end there should be free access to effective drugs and control over treatment. We shouldn't forget social support of our patients, which would incentivize patients not to drop up and to complete treatment. It is also very important to comply with the requirements of control, of infection controls in TB centers. We discussed this issue with Professor Danila, a pulmonologist, and I agree with the professor who said that not always medicines are of utmost importance in treating TB. The most important thing is to provide food for these patients, because most of such patients from vulnerable groups are not kept in hospitals. They spend time outside. That is why we can't underestimate the role of Ministry of Welfare, which should help set up special homes, special shelters for such people, because we all are well aware that most vulnerable, homeless, are most dangerous carriers of infectious agents in the state. And we should really start this huge work we have been talking about today, and which will be reflected in our Riga Declaration. The TB problem in Lithuania is still very urgent, posing a threat to the security of the state, and since 2007, Lithuania has been introducing the elements of the Stop TB strategy, and since 1998, Lithuania has observed improvement of TB epidemiological indicators. Today, more in 75 registered or notified cases of TB, we deal with pulmonary TB, although 85% would be a much more ambitious goal, which we are going towards. Taking into account international recommendations, in 2014 we endorsed the program to increase efficiency of the prevention and treatment TB program, and we hope to reach the level of the major EU countries by 2020. We have received considerable support, financial support, from the European Office of WHO. We have received help from our neighbors, the Latvians, and on our European contract for 2014-2015, we highlight prevention of MDR-TB spread. Although I don't see Dr. Head of the center in Riga here, I would like to help her. She helped us as well as many others. And financing by the European Center for financed by the ECDC program is being implemented in Lithuania. Within that program, we received training with lecturers from the European Center for Disease Prevention and Control. And to sum up, I would like to say that our Parliament and our Ministry are now considering the possibility to offer medical help to citizens of third countries. We alleviate conditions to qualify for free medical help. Not all countries have joined this, but I think it is extremely important if you can help not only your citizens, but citizens of other countries who, for different reasons, come to your country and have the right to reside in your state. We do support the declaration which we are going to discuss, and I think that it contains very good ideas, and if we manage to implement these ideas highlighted in the declaration, we'll be able to reach better results fighting TB. Thank you very much.
Health of Lithuania, and for sharing also your good practices and also building up the collaborations that you have, international collaboration. So now floor is open for for interventions from all of you. I'm sure you will also have good examples of how cross-border TB control care is being organized in your own settings, and which kind of international collaboration you have or you envisage needs to be done. So we can take some few questions and remarks from the floor. I see even Professor Solovic. Yes, Alasha. Maybe we start with you, Ivan, please.
Thank you very much. Ivan Solovic, representing Slovakia, but also European Respiratory Society. As you know, European Respiratory Society is the greatest medical society in Europe, and which play a great role in the supporting TB elimination across the whole continent. We know, very well known for all as specialists, is the WHO ERS TB Consilium, which is giving help by treating the hard to treat or more problematic patients with MDR, XDR-TB. And on behalf of European Respiratory Society, I can say that the European Respiratory Society is committed to supporting efforts eliminate TB. All stakeholders have a role to play, and it is essential that we have to work together on effective interventions that can address this serious public health threat. Tuberculosis is also, for European Respiratory Society, at the moment the #1 in case of infectious diseases. And this conference and Riga Declaration is an important step towards this goal. So I think this is on behalf not only of Slovakia, which will be the next country in the 2016 presidency of the European Union, but also on behalf of European Respiratory Society. Thank you very much.
Thank you very much. And as you see also, we have an applaud also from the audience. That means we welcome this announcement and decision of Slovakia to make TB as a priority in their EU presidency. And also they worked with the European Respiratory Society. Professional society have an extremely important role to play in order to improve the treatment outcome and also detection and follow-up of the patients. One of the very important elements is continuum of care. So that's also extremely important because if once a patient is diagnosed in country A, for whatever reason is coming back to country B, so what kind of mechanism we have there to follow? Of course, after 2 years dialogue with all the national program managers, as our regional director mentioned, we finalized and published a minimum package of cross-border. This is the only region with all the WHO regions where we have this consensus document, scientifically also peer-reviewed and published. But of course, how we can now operationalize it is not only the purpose to make a publication and have standards, but not implement them. In order to implement them, of course, there are some legal barriers, also financial issues. But we also have good examples from different countries. In fact, in our compendium of best practices, we published several of them. And I see also some of the participants who may like to share their experience and what are the suggestions to improve them. Lasha, you would like to have some interventions from IFRC?
No, just to express our commitment from our side. IFRC intervention in TB control, as I mentioned yesterday, and I want to repeat and add something, it goes at a different level. It goes at the global level, it goes at the regional level through the memorandum of understanding that we have between two institutions that of course includes tuberculosis as well as other health projects. So it includes, of course, the health issues linked to the migration, and tuberculosis is part of it. We also participate in different initiatives together with other international partners. I mean, Mariam is sitting next to me, Project Hope, so we partner very closely. And of course, we work through the national societies, Red Cross and Red Crescent societies in each country. So just to again remind to ourselves that national Red Cross and Red Crescent societies in your countries play auxiliary role also in the health activities. And two key issues that I really want to say. So we provide the workforce through community volunteers and workers, and I think the value of those people are very high, also in tuberculosis control, and also through access to the community and to the direct needs of the people who are affected by the problem, in this case to the tuberculosis. So I really want to encourage ourselves to work together, and on the first place at the country level to work closer with your or our Red Cross or Red Crescent societies. That's what I wanted to say.
Thank you very much. Any other interventions? Yes, please. Kindly introduce yourself. Thank you.
I am Lella Cosmaro from Italy, from an NGO in Italy, but I'm also the co-chair of the HIV/AIDS Civil Society Forum. And it was a good opportunity for me to be here to learn more about TB. And I think it is important that civil society on HIV and TB work more together in the future, because I could witness that almost all of the issues are the same for TB and for HIV. I express one concern from civil society. I think that in here we are very committed, politically correct people who care and have in our hearts the life of vulnerable groups, but we all know that out there in society right now, because of the economical crisis and other reasons, people often think differently, and there are a lot of populist movements who expel migrants, take out the right to health care to undocumented people, put in jail people using drugs, and they are not inclusive at all towards these vulnerable groups. And I think, my hope is that apart from the written commitments, the people here who have political power take the political leadership to make the context more inclusive for people, for vulnerable groups and hard-to-reach populations, because otherwise I don't think that we will ever reach the goal of ending TB or HIV or hepatitis or any other problem affecting these groups. So I ask that the people take the political leadership to also change the context involving all the other ministries, as it was said before, because this is obviously not just a health problem. Thank you.
Thank you. Actually, I would like to also invite colleagues from low incidence countries, particularly those people who are on the ground, as you say, to realities. For example, from UK, or if a colleague would like to, Professor Ibrahim, you would like to mention something. And then maybe Karin from Norway, you would like to also add your example. There are, of course, challenges, but also there are good practices. We want to hear those good practices as well.
Ibrahim Abubakar from the UK. So obviously, if you take the example of multi-drug resistant TB in the UK, of the 70, 80 cases we get a year, virtually all of them are in non-UK born persons. And indeed, the care of these patients entail linking with the relevant countries where people originate from. And we have excellent examples of instances where this collaboration has worked exceedingly well. For example, in the book that you have with you, the case examples that you've shared around, you'll see one where we collaborated quite well with our Dutch colleagues in transferring information between the two countries, as well as in contact investigation around the cases. Similarly, when we have cases, our Latvian colleagues are excellent in providing us with information around our MDR-TB cases where relevant. So I think such models, supported by the WHO Regional Office as well as ECDC, could be used and made more formal so that we can have effective and efficient systems to share information about cases and ultimately achieve better control.
Thank you very much. Ibrahim, Karin from Norway.
I'm Karin Rønning from the Norwegian Institute of Public Health. We have for some years had in the regulation that people who has TB or are suspicious of having TB should have the right to stay in Norway while being treated or examined until the treatment is finished. And that's worked rather well. They have received housing and social support and treatment free of charge. Everything is free in Norway, even transportation. But the last couple of years, we've met some problems we didn't really expect, and it seems difficult to resolve it in Norway. I think maybe it should be on an EU level or something, because 90% of our TB patients are migrants. That means we're in the Norwegian population, we're really nearly there that it's we don't have any TB anymore. But when people with TB comes from an EU country, like Romania, Bulgaria, Greece, so on, then the municipalities deny to give them social support. So if they come to Norway and maybe sort of paperless, don't have the right insurance papers and so on, they have the treatment in the hospital as long as they are contagious, but when they are not contagious anymore, they're left on the street or expelled from the country. Because the social government says that an EU citizen will have the right to TB treatment in their home country, so they could just go home. And we all know that not all EU countries are able to treat their inhabitants in a proper way. And we really has not been able to solve this because the problem is so little in a so rich country, but the fences are really rigid between the health authorities and the social authorities.
Thank you very much. Any other interventions from the floor? Yes, please.
Sarah Branchy, I'm the head of International and European Affairs at the Ministry of Health in France. So let me express first on behalf of the Minister of France and our Director General of Health, Benoît Vallée. They are very sorry because they'd love to be there, but unfortunately the new law on health is on discussion now before the Parliament. So please let me add my voice to the previous speakers and recognizing that this global health threat requires a collective response. And as you said, Mr. Ryan, it's true that the legislation is there, and we are very, we will pay particular attention to this because we think that we should anticipate a spread, so our collective answer is particularly important. And as it was said before, it is also a matter of social a social right and social matter, so it requires also a lot of solidarity. And particularly regarding universal health coverage, as it was said by Margaret Chan during the World TB Day. And in this regard, the role played by WHO Regional Office of Europe for strengthening health systems, particularly in this period of transition, is very key. So we are in your hand to be very collaborative with other European countries to move forward and to have concrete milestones in this regard.
Thank you very much, Representative of France. Before going to Portugal and Belarus and Armenia colleagues, if you permit, I would like to ask panelists if they would like to reflect on this now, or you prefer to have at the end some 30 seconds intervention from your side. Should we wait till the end, or you have some interventions at this level?
May I just briefly pick up on the two last points that have been raised? First of all, with regard to France, I fully agree with you, and good luck to the new law that you are introducing in the Parliament. But having said that, what I would like to highlight is that France is also in the forefront to promote intersectoral collaboration. And at the end of April, we are going to organize a very interesting meeting in France, which brings health and social sector together, involving also the education sector. And in this discussion among the sectors, the tuberculosis issue is a very important priority because of the social dimension. So we should definitely bring it into the discussion. With regard to Norway, what I would like to say is that as we are going to discuss the public health aspects of migration in the European region during the upcoming regional committee, we could present your case study as a very good example in the discussions and discuss how we can develop collective policies that are mutually accepted in the countries, and hopefully this will lead also to some policy discussion in the next year's regional committee.
Dear ladies and gentlemen, as a legal professional, I am not a medical specialist, although a Minister of Health of Lithuania. I think that considering this question, we first and foremost have to proceed from a unified platform. And I really appreciated the intervention by the Norwegian representative. And I think that this proposal is to be made from the European Commission, because who else could finance this movement? And it has been very rightly said that a patient has to be treated in the state whose citizenship he or she holds. But people do migrate, they become labor migrants, and there are lots of Lithuanians in Norway as well. So I think that this issue is to be discussed at the level of the European Commission, and there should be adopted some recommendations that could be the same for all of us, because if we do it separately, we won't achieve good results. Thank you. Dear colleagues, it has been more than interesting to listen to the opinion of different organizations from different countries and non-governmental organizations. But to reiterate, the TB problem is not only medical, and neither it is only medical and social. Take into account migrational processes, and to say that a patient has to be treated in the country of his origin is, to put it mildly, not pragmatic enough. I think that transnational programs like Global Strategy and minimum trans-border packages are to be complemented with the list of patients who are eligible to the continued treatment. Apart from that, legal acts in every country are to be in place, and management as well. We are talking here problems financing, decentralization, transfer to inpatient care, to outpatient care, but only transnationally we can tackle the problem of TB.
The points that were made. First of all, many of the European Union member states, but also countries of the neighbourhood region, are in a state of economic difficulty at the moment. And therefore the pressure, there is great pressure, as we've heard from several interventions, on the healthcare budgets. And therefore I think it's extremely important that in statements such as the Riga Declaration, which hopefully will be adopted in a couple of minutes, the human rights aspects are stressed, because basically this is an issue of human rights, as several of the colleagues have said. And human rights don't carry a passport. Human rights affect everybody in the population, whether they carry a passport of a particular country or a passport of another country. And therefore I think we really have to focus on how to protect the human rights and the rights to health also of the vulnerable members of the population. We had discussions before with our colleagues from Greece during the Greek presidency, but also with colleagues at a special conference organised by the Italian Ministry of Health in relation to the challenges posed by migration. And this is an ongoing debate. It's an ongoing debate in terms of illegal migrants, but also of legal migrants and how to deal with legal migrants. So I think there's a lot of work which needs to be done there. But I think you really have to start off with a strong statement of principle from the beginning that people deserve a high level of health protection, whether they're living in their own country or living in another country. And this is really the focus of this particular table here today, to explain that it's not simply a national problem, but there are many international aspects which need to be looked at. Returning to our colleague, the Minister from Lithuania, just to recall that the Commission is envisaging at the moment the possibility of adopting a new policy document which will link HIV, tuberculosis and hepatitis together. And this is something which we hope to work on in the coming months with the Member States. And of course, anything that we do at the European Union level will be very closely linked to what the WHO is doing as well.
Okay, thank you very much, John, for this good news and preparations ongoing. Let's go to Portugal. Raquel, you wanted to have some intervention, and then Alina from Belarus, and Miriam from Jakab. And in the meantime, if I may ask the panelists to think of maybe 30-second message, key home message they would like to pass.
Good morning, Raquel from Portugal. Okay, Portugal has been struggling to decrease incidence below 20 per 100,000. It finally succeeded. We have worked on several issues. One of them was vulnerable populations, including drug users, inmates, and migrants. Now, all migrants, regardless of their legal status, have access to health care and to full treatment until the end, free of charge. When we see natives and migrants, we see that the time between symptom and diagnosis and even outcome is similar between natives and migrants. So I think this is one way to see that it really works. We also defined minimum information that should be shared between countries. And whenever we have a patient that crosses borders, we try to exchange that information with the other country. What we see is that there is definitely a lack of information shared. We don't have information back, and we should improve this share of information.
Thank you very much, Portugal, and congratulations with reaching the low incidence threshold. And obviously there should be some mechanism also taking into account the legal and confidentiality issues that are extremely important. As mentioned also by colleagues from ERS, Professor Solovic, there is this e-concilium we are going to discuss also with Commission in terms of whether it's feasible to use that platform for exchange of information between the patients. So that is work ongoing. Let's go to Belarus from Alina, please.
First of all, I would like to thank to organizers for inviting me. I never participated in such high level of meeting. Thank you very much. But I think it's very important topic, vulnerable groups, because if we will have early and proper and rapid diagnostics and proper treatment regimen and new drugs and proper infection control measures, it will be nothing without including access for vulnerable groups for diagnostic, treatment and prevention. And we know what we have to do. We have to collaborate with a lot of ministries. We have to improve access for this vulnerable group, but as a clinician, and I involved in TB care more than quarter century, I didn't understand till now what we have to do, what we can, as quickly as we can do to improve, to increase access for this group, because if one patient has two diseases, tuberculosis and, for example, alcohol addiction, etc., we will never achieve our goals without. Maybe Masoud can answer.
I wish I would have one answer, but certainly, thank you very much, Elena, for that. We go for the last intervention from the floor before going to the panel. Miriam, would you like to say a few words? Very short. And then we go to the panelists to hear from them the take-home message, and then go ahead, and John, we can round it up, no?
Thank you, Mariam Sianozova, Project Hope. I just want to use this opportunity to let you know that with the financial support from Global Fund, we a few months ago started TB control among migrants program in Kazakhstan to address TB control among migrants in Central Asia. And the program was actually designed with the technical support from WHO and will be implemented together with WHO, IFRC, and IOM. And it will be a big attempt, I think, in Central Asia to operationalize the minimum package for transborder control, starting from legislative frameworks and finishing with enabling environment, involving NGOs into support, treatment, and diagnostic among migrants, including undocumented migrants. Thank you.
Thank you, Miriam. We go back to panelists. If you have take-home message in 30 seconds, it's a challenge perhaps, but if you could have your remarks. Our Regional Director, Zsuzsanna.
Well, first of all, our aim has to be to eliminate tuberculosis from our region in our lifetime. And for this, we need to build on the good work of the last years and continue with intensified efforts with strong political commitment, financial commitment, and strong partnerships. We have to finalize the global and the regional strategies and action plans, and I would like to invite each and every one of you to contribute to it, because it is and it has to be an inclusive process. But we have to put this global and regional action plan and strategy into the broader context of health policies and health system thinking in order to achieve our aim, and also to bring in the usual European values that, like human health as a human right, solidarity, equity, and other important issues. We also have to make the link to the antimicrobial resistance, ongoing work, and the global strategy, because the two are interlinked. And in our work for TB, we have to focus on vulnerable groups. Thank you.
Thank you very much, our Regional Director. Honorable Minister of Muradyan, would you like 30 seconds?
Thank you so much. Dear colleagues, of course I would like to call for consolidation of our efforts in the fight of tuberculosis in the framework of global strategy adopted during the Global Health Assembly for minimum cross-border control. And of course, efforts in civic society should be consolidated on the level of mass media, civic society and NGOs, with involvement of all the layers of our societies, which will be the key aspect in fighting of tuberculosis on national program level. I think that we have discussed a lot, we have heard a lot of good proposals, but perhaps I couldn't hear or I didn't get the opportunities for cooperation of recognized experts among our countries. Of course, every country has senior pulmonologists, we have professors on tuberculosis. Of course, we are a number of experts, but the best solutions are decided when people knowing the best and in most greatest details are able of discussing and adopting decisions offered, for instance, to another country or to regional office of WHO. And I would like to wish to work harder and to make friends among our professors, our most experts. I also support our panel discussion participant as regards the human rights. I have been working for 20 years in that sphere. I know how hard and how required that job is, so that every person you are assisting would feel him or herself a decent citizen of his or her own country. And in this field, non-governmental organizations should join their efforts more. They are working hard, especially about HIV and AIDS patients, but TB patients are sometimes forgotten, and thus I would like to give my message to call for such joint effort among NGOs.
By thanking our three panel members and also my co-presenter from WHO. I think a number of very interesting topics were raised during this discussion, and I think probably we could continue the whole afternoon discussing some of the issues. I think for me the key message is that the solution for elimination is not simply something which can be engineered at national level or regional level, but it's an international issue. And also that there are many aspects in terms of a movement of people which need to be sorted out and addressed as well, and also the issue of the right to healthcare and human rights in general in healthcare, particularly for patients suffering from communicable diseases. So I think the Riga Declaration sets the bar quite high, and I'm very happy to hear that future presidencies of the European Union are already planning to continue this discussion in the future, and perhaps it will be important to look at monitoring progress between now and then, because if we just come back in 2 years' time and simply repeat the same thing, that won't be very satisfactory. So I think the focus is really on now trying to make some progress. Thank you.